Hello, I'm Kalia. This is my competency checkoff video for catheter insertion on a female. I'm just going to start by pretending that I am entering the patient's room. Knock, knock, knock. Hello. Hi, my name is Kalia. I'm one of the nurse's assistants. I'll be helping you today. We're going to be getting you a catheter. What a catheter does is it goes up through the urethra and it helps drain any urine that you have in the bladder. This is a sterile procedure, so we are going to have to set up a very sterile field so that way there's no chance of germs or infections, as this is a very invasive procedure. It should be over very quickly though, and we will get you feeling better. Is that all right with ya? Yeah? Okay, before we get started, first things first, patient identification. So I would first always look at the patient's name on their wristband. Can you please tell me your full name and date of birth? Okay, perfect. I'll check that on their wristband. Okay, you are who you say you are. Any questions about today and what we're going to do? No? All right. And I already went ahead and hand hygiened as well. I'm going to go ahead and raise your bed up to an appropriate height for me so I don't have to break my back. Move this up. Raise the bed up. And then also while I'm raising your bed, do you have any allergies to latex, iodine, or shellfish? No? Okay, excellent. Then we'll go ahead and proceed. All right. So I'm going to adjust everything to my height, including this bedside table here, because when we set up a sterile field, we do not want our hands to drop below our waist. This is very important for us, okay? All right. Hand sanitizer, I'll leave that over there. And then first things first is we're gonna perform peri-care before we do any of the invasive procedure that is a catheter care. Why that is because we just don't wanna get any bacteria anywhere near that bladder while we're doing this. So what I would do is I would ask for permission. Do you mind if we perform peri-care on you before we insert the catheter? I'm going to go ahead and wipe down your genital region and your bum, so then that way we can move on with the sterile procedure. So then I would put hand hygiene on, I would go get gloves, I would also get the necessary supplies, wipes, etc. for peri-care. I would open her gown, expose her while I do it, while keeping her dignity. I would expose where I need to, and then we'll go ahead. So we've already done thorough peri-care. Okay? Next is to set up our sterile field on our bedside table here. Let me actually adjust this so you can see. Maybe that'll be a little bit better, hopefully. Okay. All right. So we'll go ahead with new clean gloves and hand hygiene before those clean gloves that are non-sterile gloves. We will wipe down our surface for our sterile field. I'm choosing this as my sterile field, this bedside table. And then we've already done that, right? So we've cleaned it, we've thrown away our gloves. Now we're gonna pick up our catheter kit. Okay, we're gonna take out the catheter kit from the plastic bag. I'm going to use this plastic bag as a trash can right at the end of the bed. So then that way our hands aren't dropping to throw away things in the trash can. All right, next we're gonna do is open our cath kit. It's covered in this drape, and we're going to carefully unwrap it by only touching the 1-inch outer border, and we're not going to reach across. So we're gonna spin and spin and spin, and so that way we can grab this outer edge and pull it flat. All right, now everything is flat and ready to be opened. We're first going to take out our sterile gloves first, and we're going to place it outside of the edge of the sterile field we have created with our cath kit. We're going to first we're going to ask nicely the patient, do you mind if I uncover your peri area so then we can start the procedure now. So I'm going to uncover the patient here. As little as possible, but again, this is a sterile procedure. We do not want to constantly be moving stuff back up away from the patient with sterile gloves, right? Because that would be unsterile. So we want to expose them as much as we are willing, as much as they are willing to let us do that. Now I'm going to grab, I'll probably do hand hygiene, right? Before touching the drape. Okay, and we're going to carefully let the drape unravel and fall open. We can grab that 1-inch border and we'll put the plastic side down and between the patient's legs, just like that. Making sure not to, again, touch the inside portion of that drape because that is sterile. All right. Next, what we're gonna do is don sterile gloves. So I have them over here, right, separate from that other sterile field. We will hand hygiene. Here's my little hand hygiene. Ooh. And I'll probably move that over because that's gonna get in my way. Actually put on hand sanitizer, so I have to rub it in before I put these on. Okay, so let's go ahead and open our sterile packaging for our gloves. We're going to open it away from ourselves and drop it onto our sterile field now. We're going to throw our packaging away that we have at the end of our table, or our end of our bed. And then I am going to start donning the sterile gloves. So we can touch that outside portion of the gloves here. And we'll carefully again, not to touch the gloves, and we're going to open those. I know you can hardly kind of see what I'm doing, but we're just making sure that we're pulling that paper flat and only touching the 1-inch border. We're not touching the gloves with our hands right now. And then we'll go ahead. It wants to come back and be naughty. Okay, here we go. So then we're gonna put the glove, the sterile glove, on my dominant hand first. So we can touch the inside of that glove first, right? So I'm gonna grab it, touching the inside, holding it above my waist, and sliding my hand in without touching the outside of those gloves. Okay, we've got our right hand done. With our right hand, we're gonna take our left glove, only touching the outer side. So we're gonna stick our fingers with our thumb out, because our thumb likes to touch the sterile gloves. So we've got it on our hand, only touching the outside of that glove. We're gonna I'm gonna stick my left hand into that glove. Hold it on. Okay, now we've got everything ready to go. Okay, so then what I'm gonna do is prep my supplies that I need. So I'm gonna kind of adjust this to make me more room, just like that. And then I'm gonna get some swabs, the lube, and the syringe out. You're gonna have 3 swabs, and this is to clean, these are alcohol swabs. These are to clean the patient right before the procedure. So I'm gonna get those ready. I'm gonna throw the trash away. I am going to get the lube out, squirt a little bit of lube. However, this is a dummy. We do not put lube on the dummies, but we would in real life. I'm gonna throw this plasticky part away. And then I'm gonna attach my syringe to my catheter. As well as we are going to unsheath the catheter, which mine was kind of poorly wrapped up. So that you wouldn't try to just put it outside the sterile border. I'd be more gentle about that. Okay, So we're gonna, the way we unsheath this catheter is we're gonna make sure it doesn't wibble wobble everywhere. So we're gonna gently kind of coax it out of the covering till we get to about the tip of the catheter. Okay, so we got the sheath off. We'll throw that away. Again, do not touch the tip, right? Don't touch it, right? And we're gonna go ahead and stick the tip into the little dollop of lube that I have right here, so it's ready to go. And we'll make sure that that is also in the sterile field and everything. Okay, we'll again attach that syringe to the catheter port, and then we'll get started with wiping down the labia area with the 3 cotton swabs that have alcohol on it. So we're gonna break sterility with my left hand. I'm going to hold open the labia, okay? And get a firm grip on it. Okay, so we got a good firm grip on that. So now I'm gonna take one of the cotton swabs. I'm going to do the labia's left side. Okay, one wipe, front to back, throw it away. Then I'm gonna do the right side of the labia, front to back, one swipe, throw it away. The last one in the center of the labia, front to back, all the way down, throw it away. Perfect. All right, now we're going to gather our catheter by coiling it in our hand, making sure we have a firm grip on that labia, right? We're not moving it because we would break sterility if we moved it. And we're going to gently, with our pinky and coiled, the tip is up, put it on this sterile drape. Okay, there we go. All right, now we're going to locate the urethra, and we're going to go ahead and start advancing the tip of the catheter. The most important thing to keep in mind with the insertion process is that you do not want the tip of the catheter to touch anywhere else in the labia, as that can introduce bacteria, right? So we're going to go ahead and find the urethra and start sticking the tip of the catheter in. And we'll keep advancing. I'm pushing in with just my index and thumb finger, and pushing in, and we're going to keep going until we see urine in the tubing. So we'll pretend and say I see urine, so we'll advance 2 to 3 inches more past that, and we'll go ahead and we will inject 3 cc's of our saline solution to inflate that balloon. And what that balloon is going to do is to hold the Foley into place, all right? Another thing to keep in mind, in real life, on a real woman, you would put in 10 cc's, but since this is a dummy, we're doing only 3 cc's. So I'm going to go ahead and inject that saline solution to blow up that Foley balloon. All right, so we got 3 cc's. Next, we're going to go ahead and give that a little bit of a tug. We're going to gently tug and make sure that we feel resistance, to make sure it's firmly placed in the bladder. Okay? All right, and then I would ask the patient too, most likely. I would always be communicating with the patient and be like, does this hurt at all? Do you feel uncomfortable? Are you okay? Is this okay right now? Do you feel it? We have it in there, Miss Susie, but I just want to double check to make sure that you're comfortable with it. It's a weird sensation, but it's going to be better for you in the long run, right? Like, I would constantly be checking. Okay, so we got that all good. We got 3 C's inflated into that balloon into the bladder. So now we are good to go ahead and hang our catheter bag. So I'm going to drop, we're now breaking the sterile field, right? So we can unclip that saline flush. We can throw it away. and then we'll go ahead and hold, hang up our catheter bag, right? And the way we want to do this is very particular, right? Because we want to prevent any infections as much as possible. So we do this in such a way that the bag is always below the bladder, like I was poorly demonstrating, holding it up. It would be below the bladder, and we would hang it on the bed without any loops, so then that way the urine is constantly flowing out of the bladder into the bag. There's no stagnation of urine in the tube that can cause infections. So we're going to clip this onto the bed on a movable spot. So it doesn't get hung up anywhere, and I can move this so I can demonstrate. We would hang it on the metal part of the bed so it moves with the bed and is not getting hung up. As well as we're gonna straighten this out so the urine does not get stagnant, which would be creating a dependent loop. So we'll go ahead and clip. We have a little clip right here on the tubing. We can clip that to the bed sheet here to straighten it out. And then we would just tell the patient that anytime she needs to get up, she has to let one of us know, because we'll constantly be making sure that the bag is below the bladder, and we'll have to readjust accordingly. Now we can go ahead. We've kind of already done everything, so we can cover her back up, give her her privacy. We can take away the drape, and then we can only sort of promote the we'll promote that infection prevention of CAUTI. CAUTI is that catheter-associated indwelling catheter infection. So we will just constantly be sort of educating our patients about that, right? And that's kind of what we talked about with the bed, with making sure that there's no dependent loops, keeping the bag below the bladder, and then performing catheter care daily. So now we can go ahead and we will move the bed back down, and then we'll just ask if the patient's feeling all right. Do you have any questions? Make sure that the call light was within reach. And then, yeah, that's pretty much it. Cool. And the last thing I would do before leaving the patient's room after doing that procedure is do hand hygiene and assure that the patient is in a safe position on the bed and give them the call light.